Morning, being a Thursday, we're talking matters health. We're looking at the eye health. This week is World Optometry Week, and this day was marked on the 23rd of March this year. We're looking at a theme that says shared vision, collaboration, and global eye care. This is according to the World Council of Optometry. So that's what we're looking at this morning. What do you know about your eye health? What should you do to take care of your health? And basically that's what we're talking about. We have 2 days in the year that focused on on eye health: World Sight Day and also World Optometry Day. But World Sight Day comes, in October. But today we just want to understand what really is optometry and what it does. How different is it from what you usually know? Opticians, ophthalmologists. I hope I'm not butchering that. And for this conversation, I have Faiza Saida in studio to help us with this. Faiza is an optometrist at Dot Glasses Kenya. We'll also be understanding what Dot Glasses Kenya do and who they are, where they are, and everything in between. So if you do have any questions for Faiza this morning, we do encourage you to interact with us on our socials. TV47 Kenya on Facebook and on YouTube, on X at TV47 Digital. You can tag me at Ann_Dida. Our WhatsApp line is also active, 0793267279. Karibu sana, Faiza.
Thank you so much.
You're well?
I'm good, you?
I see, I'm good, thank you. I see you have your glasses on, so I'm wondering if they're prescribed. It's just because you're talking about Dot glasses.
I wish it was just because of talking about Dot glasses, but
Yes.
I also have a refractive error.
Aha.
So at least I get to experience what other people who have issues experience, and I get to understand what they go through.
So when you say you get to have issues that other people experience, so yours is a refractive issue, but what do you mean by I love that you've started with you as a case study, but when you say refractive condition or issue, what do you mean exactly?
Okay, so when it comes to the eyes, there are different conditions that affect the eyes. We have issues that affect the clarity of your vision, and we have issues that now come in the disease part. So when you're talking about refractive errors, it's basically what affects the clarity of your vision. You cannot be able to see well. You're not blind, but you cannot be able to see well. So we tend to equate refractive errors to blurred vision. The clarity of the vision is not there, just because light does not bend correctly in the eyes. Yes, so that's what refractive errors are.
All right. When you talk about optometry, and it's also World Optometry Day, this is not something that somebody would have in a casual conversation. We often hear about optician. We don't even hear about ophthalmologists a lot as we hear about, opticians. So what do you do differently? Opticians, ophthalmologists, and then you as optometrist.
Optometrist. So in the optical world, I believe worldwide, there are so many groups of people who handle eye care. So most of the time, as you said, people know opticians. Growing up, I knew of an optician. If I was asked, what do you want to become when you grow up? I would say, I want to become an optician. But let's start with the ophthalmologist. So basically, these are medical practitioners who specialize in the eyes. Most of them will treat the diseases, they'll cover the surgery and all that. Then after that, we have optometrists. So not so many people know about optometrists. Some of the time somebody will ask you, who's an optometrist? So basically optometrists, most of the people want to relate them with just refracting and giving lenses, but they do more. They work with the prevention bit. They work with managing these conditions. And I believe they play such a big role in eye care that most of the time they're not given the credit that they deserve. They're basically the unsung heroes when it comes to the optical world. Then we also have the opticians who are now focused on now giving the spectacles. Then we also have other people. We have ophthalmic clinical officers. These are clinical officers who specialize in the eyes. They can specialize to become cataract surgeons. We have ophthalmic nurses. So it's a whole group of people who work towards bettering eye care in the country.
So most of the time we hear that ophthalmologists are able to conduct eye surgeries. And I wonder if optometrists now, you can do that as well.
No, for optometrists, they don't do the surgeries like the cataract surgeries and all that. For them, they'll do the minor surgeries, removing embedded objects and all that. But when it comes to identifying these conditions, managing these conditions, giving the medications, they're fully equipped and trained to do these things. Yes.
And when we look at World Optometry Day as, you know, a day marked globally to just create awareness about eye health and eye care and everything in between.
Yeah.
Why is this so important? Is it focusing on you guys as professionals, or is it just each and everyone in general as, you know, as a people in this world?
I believe it's both. First of all, just to appreciate the people who are out there, the people who wake up every other morning, striving to improve the quality of eye care services that is much needed, and also to create awareness. Right now, in the current times that you're living, so many people end up losing their vision just because they're not aware. They don't really understand what's the importance of me going to an eye care practitioner, what's the importance of me getting the spectacles that I've been prescribed for, what is the importance of me maybe going in for that surgery and all that. So it's more of creating an awareness, just making this noise in the social media platform so that somebody at home can be like, okay, let me wake up, let me go and have my eyes checked. Yeah.
How does the theme resonate with you? A shared vision, collaboration in global eye care. Do you feel like, as you know, as professionals in this sector, as we've mentioned, the three that we've mentioned, opticians, ophthalmologists, and of course optometrists, do you feel like you work together as professionals to just, you know, bring some sort of change to the public when we're looking at the eye health?
Yeah, it's true. No man is an island. You can't do it alone, let's be honest, because everyone has different specialities. So you'll notice there's that aspect of referral. It starts from the bottom as you make your way up. So let's say a patient comes into your facility, they want spectacles. They've gone to an optician. The optician probably will do their refraction, and not everyone who comes into the facility necessarily needs spectacles. Then the optician will be like, okay, probably I'm not in a position to give you spectacles. I feel like you need to get further management. They'll refer them to an optometrist. The optometrist probably will manage the condition. Then they'll realize, okay, probably there's surgical intervention needed. I'll have to work with an ophthalmologist. So there's always that need for people to work with the other team, just to be able to make sure that you're providing the quality of services that are needed out there. Because if at all you do it alone, yes, you will provide the services, but is it the service that this patient needs? Yes.
And we'll be getting into, you know, diagnosis when he talks about a certain eye treatment for, you know, a certain condition, even as we look at conditions that are there in the eye. But you mentioned about awareness, that Optometrist Week, World Optometrist Week, is aimed at, you know, creating awareness about eye health. I wonder how that is as far as awareness is concerned as of 2026. And looking at Kenya to be specific, how are we doing? Are we more aware? How is our health-seeking behavior like?
Unfortunately, people are not really aware of it, because as of 2026, it's around 16-point-something million people in Kenya who have refractive errors. And out of that number that you've talked about, 87% have not been able to access the necessary equipment, the necessary management. So you can imagine the coverage is very low. So I think it's up to us, for us to be able to get this word out there. And we can use even other people. It's not necessarily just as an optometrist or as an ophthalmologist and all that. We have CHPs. These are people who can go out there in the villages. Yes, maybe they're moving around talking about hypertension, diabetes. They can always educate people about the eyes. So there's so much that needs to be done, because if at all 87% has not been managed, it's a journey. It's a long journey that needs to be covered. Yeah.
And I like that you mentioned diabetes, and before it skips my mind, the correlation between diabetes and the eyes. We often hear that sometimes people who have diabetes, they're more susceptible to, you know, losing their eyesight. How is that correlation like?
Correct. So the main culprits, the two main culprits, hypertension and diabetes. So basically these are systemic conditions in the body that manifest themselves through the eyes. So they have ocular manifestation. You see the way maybe you can have malaria, you're having joint pains, you're having fevers and all that. For people who have diabetes or hypertension, you'll notice that when the levels are elevated, maybe you've gone to have your blood sugar checked, it's above 8, probably that's high sugar levels. Maybe you're going to have your pressure, maybe it's a bit, it's reading 140 over 90 and all that. It's a bit elevated. So most of these people will present with blurred vision. Daktari cannot be able to see clearly. Sometimes you'll find that once the condition is managed, the clarity of vision comes back. So it's more of a fluctuating thing. However, we have cases of people who have had these conditions for a very long time. Someone has had diabetes for a very long time. Maybe it's not well managed, you see. People tend to assume that people easily manage these conditions. No, this is something that you're having to take medication every other day. So many people are not comfortable taking medication every other day. So long-term effects, it starts affecting the back of the eye. We have a layer that lines the back of the eye that is called the retina. It starts affecting the retina. So somebody starts having issues with the retina. So you see, we move from just blurred vision to now starting having other issues that now require more serious intervention, for lack of a better term. So also for the people out there who have hypertension, who have diabetes, we advise you at least yearly, get your eyes checked. Let us not get to a point where we now have to seek more serious interventions. Yeah.
You've mentioned about retina, but I think that as we proceed with this conversation, it's only right for us to understand the anatomy of the eye. Before you even get to a point where now somebody is, losing their eyesight. Walk us through the anatomy of the eye and what happens.
Okay, thank you. So basically, when you talk about the anatomy of the eye, the human eye is quite a complex organ. People spend years learning about this small organ that you can see. So maybe I'll just narrow down to the organs that are responsible when it comes to the clarity of your vision. Someone can have blurred vision as a result of the disease, as we said, or as a refractive error. So when you narrow down now to the refractive error bit, we start from what you can be able to see when you look at me. There's that black hole at the center of the eye. We call it a pupil. It's important because this is where light gets into your eyes. For you to be able to see clearly, the light needs to come from the environment and gets into your eyes. Then after that, you have this bigger circular structure, for lack of a better term.
The white one?
No, it could be brown, it could be blue, green, the bigger one that borders the pupil. We call it the iris. It's not just for beauty purposes, it has a function. So the main function of the iris is to regulate the size of the pupil. So let's say right now we're in an environment where it's light, there's a lot of light. At this point, the iris will tell the pupil, you know what, we're receiving too much light. We need to constrict so as to reduce the amount of light that gets into the eye. Then I move to an environment where it's a bit dull. The iris will tell the pupil, we're not getting enough light, you cannot see well, you need to dilate. So it has a function to regulate the size of the pupil. Then you have this clear outer protective layer, the clear bit. It's called the cornea. Plays a big role because you need to have a regularly shaped cornea. But at any point, if your cornea is irregular, it can also result to a refractive error. Then now we move to the inside part, the parts where you cannot be able to see. Just after this big circular structure, we have something like a lens. This is the organ that is responsible for focusing the light at the back of the eye. So the lens is crystalline in nature, transparent. It helps light focus at the back of the eye. Then now we have the retina that I mentioned. It's basically the powerhouse. It's responsible for receiving this light, converting it to brain signals because it needs to go to the brain. Then after the retina, we now have the optic nerve that transmits this information to go to the brain for interpretation for you to be able to see clearly. So you need to understand that light travels differently in the right eye and the left eye. So it's possible for you to be able to see clearly in one eye, then have a problem in the other eye. Or you have problems in both eyes, but the lens requirement is different. Or you need the same power. So it's quite a bit complex.
Interesting.
Yeah.
The light travels differently in each eye.
Yes.
Oh, wow. We are learning. Let's take a look at what people are saying online. We're talking about eye health, the silent threat of your vision. And we start off with Mercy. Mercy's watching from Nairobi. She says, I'm always on my phone day and night. I didn't even know this could damage my eye silently. I've never gone for an eye checkup. That is Mercy. We also have Kevin from Nakuru. These headaches I get after work now make sense. I stare at a screen all day. Maybe it's time I take eye health seriously. Yes, that is what we're talking about. We also have Aisha from Mombasa, and she says, we ignore our eyes until it's too late. I only went for a checkup when I couldn't see properly. Prevention is better. And that issue about fatigue. How often do we, ignore fatigue as something, kuchoka acha nilale, and then it will just get better while it has issues to do with our eye health?
So many of us ignore that. Because at the end of the day, you'll just be like, okay, maybe I was at work, I strained, I'm tired, I'm going to sleep. But you see, these are some of the symptoms of refractive errors. There's so many symptoms that you can be able to associate with refractive errors. The most common is blurred vision. I cannot be able to see clearly. Then now it goes back to fatigue or tired eyes or sore eyes. At the end of the day, I don't feel like using my phone. My eyes tend to feel very tired and all that. That is a symptom. Some of them have headaches, temporal headaches, frontal headaches. Very common. You go to a hospital environment, someone has been tested for malaria, they've done all the scans, then later on they tell you know what, you need to go to the eye, you need to get your eyes checked. So all these symptoms can narrow down to refractive errors. Probably it's because you're straining, probably it's because you have an uncorrected refractive error that you have not looked into, probably it's light issues, so you need to really figure it out, and the only way you can be able to figure it out is by getting your annual checkups. Yeah, it does.
So somebody also mentioned that they rarely get their eyes checked. You mentioned annual eye checkup. So the question I wanted to ask, when should we get our eyes tested? When you say annually, is it only annually, yearly, or sometimes they say other conditions you have to get checked after every 3 months. You go get maybe your teeth checked, they're washed and all that. But for eyes, is it only annually, or we can do it in intervals?
Okay, if you have the financial muscle to do it as frequent as you want, feel free to do that. However, at least every year, if you can be able to go to your eye doctor, get a detailed examination of the eye, let them check about the refractive errors. If they're able to do it, let them even check the back of the eye, they can check the fundus and all that. So it's just to ensure that you're sure you do not have a refractive error and there's no other medical condition that affects the eyes. Yeah.
Somebody also mentioned that sometimes people wait until it's too late for them to get their eyes checked, or maybe they see that the vision is becoming quite blurry and then they start looking for medical intervention. So are these conditions reversible when detected early?
Unfortunately, no. Because when it comes to refractive errors, there are causes that cannot be prevented. Like you remember when you mentioned about the cornea. The shape of the cornea. There's no way we can alter that. But right now people are practicing laser, but you see already it's there. Probably it's because of the length of the eyeball. That's something that you cannot be able to prevent. The genetic implications. There's a family that people are using spectacles, you cannot be able to prevent. However, once the onset is there, we advise you to get your annual checkups because there's always progression. Let's say, for example, short-sightedness, we call it myopia. It tends to progress. So we always advise you use your spectacles, get your annual checkup, let the doctor keep tab of how the prescription is going, and specifically for children. If at all you have a child who has, let's say, short-sightedness, we advise you let them get their checkups frequently, because right now the things as myopia control, practitioners are practicing myopia control. They use eye drops, they use what you call ortho-K, all that. So it's better off getting these things managed early. It might not be, you might not be able to stop it, but you can be able to manage the progression. And at the end of the day, we want you to be comfortable. We want you to see clearly for you to go about your day-to-day activities without straining.
You mentioned something about, when we were talking about the anatomy of the eye, you say that the iris, sends a signal to the pupil just to tell you that, hapa, we are not getting enough light, or, something, we are getting much more than we need. Then there's contact lenses. When people now prescribe contact lenses for themselves, because sometimes people self-prescribe, then does it still send the same signal? And now it doesn't work the same when now somebody has contact lenses on?
When you're giving contact lenses, you have to check for the fit. That's why we advise you don't just go and get a contact lens from somewhere. For an eye care practitioner to give you contact lenses, they have to do a refraction. They need to know which is the right fit. The contact lens has to fit properly in your eyes. So if at all you go out there and you get a random contact lens, the fit will not be comfortable.
For beauty?
Yeah, for beauty. Even if you need for beauty, go to an eye care practitioner. They'll be able to advise you because you'll be uncomfortable. With the contact lens, you need to be comfortable to blink, you need to do all that. So there are so many tests that need to be done before an eye care practitioner can be comfortable to dispense these things. So yes, we want to look nice, everyone wants to look nice, but at times also look at the long-term effects. And for things like contact lenses, you need to be careful. You don't have to sleep with them. You're not supposed to sleep with them. You're not supposed to swim with them. So you see, if you go out there and you buy them without getting this necessary information, you can wake up one day and you've lost your vision just because you did something, I would not want to say ignorant, but because you lacked the necessary information. And that's why you have eye care practitioners make use of the knowledge they have. Yeah.
And are they safe as compared to glasses? Are they a safer option? Because we're looking at if you go to sleep with them, then you might wake up one day blind. So are they really a worth go-to option?
Yes. It's okay as long as it's well prescribed. It's okay, and also you're required to follow the instructions. The same way if you're given, let's say, oral medication, if at all you use 8 hourly, 6 hourly as instructed, it's good. But if at all you go and overdose yourself, it has long-term effects. So that's the same way we're looking at it. If it's well used, it's an okay option because not everyone is comfortable with wearing spectacles.
And most of the time we've heard of infections that are caused, by wearing contact lenses. So what causes these infections?
Hygiene. Let's start from there. That's a big issue. You have to wash your hands. You have to make sure you've stored your contact lenses well. There's a solution you're given to store it. So most of the time you notice people do not follow these small things. Then they end up leading to the infections that you're talking about. Yeah.
So how long should contact lenses be worn? We say that, for example, for glasses, they should go for a year before another analysis. How about contact lenses?
So for contact lenses, we have different contact lenses. We have daily contact lenses, the some that you put on every other day when you dispose. We have monthly contact lenses. You have them, you put them on in the morning, let's say after 6 hours, 8 hours, it depends with which one you've gotten. You'll remove them, store them safely, put it on after 1 month, replace them. You have yearly contact lenses. So it depends with what you chose. It's a discussion you have with your practitioner. You decide what you're comfortable with. Yes. The most advisable, the most advisable daily because the hygiene issue won't be there.
Is it cheap? Daily? When you talk about daily, unava contact lenses daily. How affordable is that and how reasonable is that even in this economy?
The financial implication is not reasonable. That's why at the end of the day you realize so many people just decide to go for their spectacles. Because right now with the current economic times, even just affording a pair of spectacles is a bit of a hassle. So you can imagine affording daily contact lenses because let's say you get one for 600 bob or something. I'm not sure of the cost right now. So it does not make sense. So you'll realize so many people just decide, you know what, let me just get my spectacles. Because if at all someone is struggling to get food on their table, how will they be able to afford contact lenses? But if someone has that financial ability, then they can always explore that option.
And Faiza, I should have asked, I'm seeing a bag here. What do you have in store for us? Up and down.
I was waiting for that. So for the bag that you have, so basically this is a dot glasses bag. So in this bag, you can be able to test and assemble lenses like the frame that I have and give the clients. So for dot glasses, what we do is that our main mission is to provide affordable eye care to the people out there. And we do that by giving simpler solutions. You see, for you to have an optical shop, you need to have maybe the phoropters, the machines, you need to have the autorefractors, you need to have the trial box. It depends with what you're doing. And the financial implication is a bit too heavy on these people. And that is one of the reasons why so many people are not getting eye care because not all eye care practitioners are able to set up these things. But you see with the bag that you have as dot glasses, in this bag we've tried to simplify everything that you might need to do a basic refraction. Instead of the trial box, instead of having the phoropters, we have our lenses simplified to this. We have our charts here. We have the pair of already cut lenses distributed all through. We have the different parts, like for my frame, I can show you my frame. It comes in parts. So We have them distributed all over. So all these things are here, the lenses are here. So it's just a matter of a practitioner setting up an area. Even you can convert this studio into a checkup room in a very quick.
Yeah.
Within, if at all you have the necessary skills, at least 5 minutes, you've already tested somebody, you have dispensed the spectacles and you have given them. And other than just being able to dispense the spectacles, remember I mentioned about eye care. We are very keen to ensure that, you know what, these people have gotten the best services. We have other gadgets. We have something like the arc light, very new. For the people who are in the eye care field, they'll know that we have, like I mentioned, testing the funders. This small gadget can be able to diagnose all these conditions. You can be able to get glaucoma, you can be able to get diabetic retinopathy and all that. So we try to supply practitioners with the simplified tools that will save their time, that will save them from space. Not everyone has enough space to do these things. That will also be cost effective for them to be able to do it. So if at all you have this bag, be rest assured nobody will come into your facility. If at all they need spectacles, they will get the spectacles. If they need further intervention, you can be able to do the screening, you can be able to make the diagnosis. Then if it's an eye care practitioner who's able to handle it, you do it. If you're not able to handle it, please work with your colleagues so that you can be able to serve these people, because at the end of the day, it's about the well-being of the patients that we have there. Yeah.
There's something umetuonyesha hapa, how to test it, but just so we go step by step, how do you use it exactly to test the eye?
Okay.
It's in this bag?
Yes. So what, or this one?
Yes.
Okay. So what happens is that this is called an arc light. So for the arc light, it has different functions. It's a small gadget, but it does a lot, a lot. So it has the front part. We call it the anterior segment loop. For this one, it can be able to examine the external parts of the eye. You can check for conditions in the eye. You can check for infections and all that. So you start with the examination of the eyelids, you go into the other organs. Then after that, you can also be able to examine the anterior part of the eye. So at the back of the eye, it's categorized into two parts. There's the anterior part and the posterior part. So with this side, you can be able to check the anterior part of the eye. Then when you switch to the other side, on this, where the bud is, the small bud is, it can be able to check the posterior part, check on the organs that are inside the eye. Then other than that, it has so many other things. Everything that you can see here is not for decorative purposes. It has its function when it comes to the eyes. We have the red desaturation test. We have what you call the PD ruler. We have the color vision strip. We have a rack of lenses. Then the beauty of this gadget is that you can be able to use it locally, anywhere, because first of all, it's portable, it's affordable. If you narrow down to buying these gadgets individual, and also you can be able to convert it to an otoscope, so even the people in the ENT can be able to use it. So the when it comes to the financial bit, affordable. You do not need to charge your batteries. There's a solar panel, so it's just a matter of me moving around, hanging it on my neck, and it can be able to be charged. So it's such a small thing. Then
it's not a toy.
It's not a toy. A child can play with this or even eat it. Then the most important bit about it is that I can be able to attach this arc light to my phone, in that if I'm a medical practitioner, let's say there are people somewhere in Kenya where you do not have an eye care practitioner. If somebody has a skill of doing the basic things, you can be able to attach this to a phone, do your examination, record it, share it with an eye care practitioner who can help you make a conclusive diagnosis. So I think it's making a big change when it comes to the eye care services that you're doing.
How accessible is this equipment in the country?
If you need it, you just reach out to us as Dot Glasses and we give you. It's not that accessible. So many people do not have it. And I feel so many people need to have it. So if you need it, you just reach out to us as Dot Glasses and we'll be more than glad to help you. And you also have so many other things that you can be able to share with you. Yeah.
So when we talk about silent eye damage, of course, as we go step by step, what do we mean medically?
Okay. So when you talk about silent eye damage, you know, the eye conditions that are drastic, for lack of a better term. The symptoms present themselves very quick. But you also have other eye conditions that the symptoms are gradual. You cannot be able to tell. One of it being refractive errors. Before you realize, there's so many times you go out there, you realize that the practitioners who are screening people, someone realizes, okay, Yes, I cannot be able to see with my right eye. Some of them don't even know until you ask them, okay, can you be able to read the chart? The chart that a doctor presents to you. It's called a visual acuity test. So most of the time, people do not realize they have refractive errors until they get a
Even those ones who
test.
pretend.
That is a bit difficult, but there are tests that you can be able to do for you to be certain that, okay, this person cannot be able to see and they can be able to see. So it's just about getting your test for you to be able to know, okay, I cannot be able to see. Personally, I think I used to see clearly, but the moment I'm doing a visual acuity test, I'm asking someone, can you be able to read that? And the back of my mind, I'm like, okay, I also cannot be able to see that. Then you realize with time, it's getting worse. So it's something that affects the clarity of your vision slowly. And by the time you realize, you're now dependent on the lenses. Yeah.
So which conditions fall into this category of, you know, the silent damage to the eye? I know you mentioned something about glaucoma just casually.
Yeah.
You also talked about myopia. But just step by step, these conditions that now lead to it being, you know, damaging to the eye.
Okay, so as you said, the refractive errors, then you also have the diseases. So the diseases like glaucoma. For glaucoma, it's basically elevated intraocular pressure in the eye. The same way you have pressure in the body, we also have pressure in the eye. And glaucoma is actually a silent thief of sight because it slowly damages the optic nerve. So you'll notice one day the pressure in the eye is too much, it has damaged the optic nerve. Once the optic nerve is gone, you cannot be able to see. So you can be able to screen that using this. Then you have things as cataract. Very common, very common among the elderly. Not the elderly also only. We have congenital cataracts, kids are born with cataract. Maybe you've been involved in a fight or an accident, trauma to the eye, this cataract. So with cataract, at times it's also silent because it starts from an immature stage to a matured stage. During the early times, you might not be able to realize you have cataract, but as it progresses, you realize, okay, I cannot be able to see, my vision is cloudy. Things like diabetic retinopathy, it starts from you having the fluctuating sugar levels. Then you realize, okay, I'm having blurred vision. Then it moves to having dark spots in your vision. So there's so many things that affect the eyes. You might not really be able to tell unless you have constant eye tests. And once, probably when the symptoms are too much, maybe it has moved to a certain stage, then now you start now being able to see the signs and the symptoms. Yeah.
We've heard time and time again that glaucoma, for instance, is a silent thief of the eyesight. And why is it so dangerous? And I'm looking at it from the point of myopia and these conditions that we're talking about. Why is it a silent thief?
Okay. So you see, for myopia, for hyperopia, all those things, they're refractive errors. Once you use your spectacles, you can be able to see. So it's more of a reversible thing. For glaucoma, once it's there, it's not managed, it damages the optic nerve, it's not reversible. So as much as it's a dangerous condition, if at all you can be able to identify this condition early enough, early detection, the doctors may decide maybe to put you on medical intervention, others may decide to take the surgical intervention route. So if at all you identify glaucoma early, you just manage it as any other condition. People live with chronic conditions, you live with it. If at all it's not managed and identified early, then now you end up losing your vision and it cannot be reversed. So there are things that people need to look out for when it comes to glaucoma. Sometimes it's genetic, it runs in the family. So if at all you have people in your family that have had this condition, maybe just be a bit keen, do your eye reviews, okay, depending with the duration that you can be able to do it. At times you'll find that people with glaucoma, actually it's interesting that most of the time people never know they have this condition until the symptoms have now projected it. So we always advise you, please get your checkup early enough so that they can be able to manage. We don't want to get to a point where you've lost your vision because nothing much can be done.
Now the telltale signs to look out for, because clearly they have to go, you know, to the hospital when there's something. Kitu ndio itakupeleka huko. So are these telltale signs to look out for?
Okay, things like eye pain. Then there's loss of peripheral vision. We have what you call tunnel vision. So you'll notice that someone with glaucoma, they start losing. You see, you're at least aware. I'm aware of what's happening on this side. As much as I might not really be able to tell, I'm aware of it. For people with glaucoma, they start losing their peripheral vision. So slowly the vision narrows down. So if you realize that, there's that test that you can just ask someone, maybe do this. If you cannot be able to see your hands clearly, maybe you can go to an eye care practitioner. Maybe you realize that it's running in the family, there's pain in the eyes and all those things. So maybe look out for those things. Then to be sure, the test that can be done, they can check your intraocular pressure, or they can be able to check your optic disc, just for them to be able to make a conclusive diagnosis.
All right, let's get more feedback so that we can also interact with our viewers online. We have Brian from Kiambu, and he says, blue light, laptops, phones, we are exposed to every day. The damage is real, but we don't talk about it enough. We also have Sharon from Eldoret. She says, I thought eye checkups are only for people with glasses. Clearly, I was wrong. We have James from Kisumu. This topic is an eye-opener. Literally, we focus on other health issues and forget about our vision. These are, what people are saying online. But let's talk about causes, because sometimes we hear that somebody would lose their vision in adulthood. You wake up one day and you realize that you cannot see anymore. You walk into a hospital and you're pronounced maybe blind, or you're told you can only see to a certain percentage. Then what are the causes of these eye issues that especially that would lead to somebody losing their eyesight if they were not born blind?
Let's even start, uncorrected refractive errors can result to conditions that might make you lose your vision. For example, high myopia, long-term effects. It makes you at a higher risk of getting things like glaucoma. Glaucoma will eventually lead to you losing your vision. Early onset of cataract because of uncorrected myopia. All those things we talked about, the systemic conditions in the body, diabetes, hypertension, they cause that. So there are things that probably can be prevented, and there are things that probably just need management to slow down the progression to lead you to that.
There's this chart that I'm looking at, and I know it talks about certain disorders and how they differ from one to another.
Yes.
You could just walk us through that, what you're looking at.
Okay. So as dot glasses, some of the things we do is to empower people out there. Some of the things that we do is we educate people on eye health. So for this chart, most of the time, we give it to people who are out there to educate other people. Let's say you're a clinical CHP. You're out there, you do not know these conditions. We do not subject you to get to know all these conditions. So what you do, we highlight the conditions, some of the symptoms that you can look out for when you're engaging the patients. So let's say, for example, you're out there, you get somebody who has cataract.
So you can just show it to this camera.
I hope you can be able to see. Sorry about that. So maybe you're out there, you get somebody who has cataract. We tell you, okay, with cataract, the symptoms to look out for: gradual loss of vision. So when you're engaging your patients, they tell you, you know what, I've been losing my vision slowly. There are things that you can be able to see. Then you've tried to highlight these conditions, like for the ones in red, please consider them as emergencies, refer those people to eye care practitioners. For the ones in yellow, you can advise them to do that. So it's basically for us to be able to educate all those people. We have not put all the conditions. There's so many conditions, but you've narrowed down to the most common conditions that at least in a clinical setup, they'll experience one of these in a day or something. Yeah, so that's the whole purpose of this. Then you have so many conditions. You have cataracts, you have trachoma, we have diabetic retinopathy, glaucoma.
How does the cataract look like in that chart?
Okay, so with the cataract, if you can be able to see this eye in the pupil, the black hole of the eye, it tends to appear a bit cloudy. So for the cataract, it's more of a cloudiness that clouds the front of the lens. So at any point, if the lens is cloudy, light cannot be able to get into your eyes. And if light cannot be able to get into your eyes, you cannot be able to see clearly. So if at all you have a cataract, it does not mean you've lost your vision. It just means you need to go for a small incision cataract surgery. They remove the cloudiness, they remove the affected lens, they replace it with an intraocular lens. Your vision goes back to normal. If at all it's not managed, it can lead to loss of vision. You can end up being blind, but we call it a reversible type of blindness. And this is actually such a major concern in Kenya because so many people, especially our elderly population, so many of them get to have cataracts because they're not aware. It's very unfortunate. You go somewhere, you meet somebody who's being held. That person walks into your room or somewhere you are, they're being held. That person simply just needs a small incision cataract surgery and they can be able to see. So it's just a matter of us highlighting these conditions so that that person who does not know these conditions, at least they can be able to go somewhere and get help. Yeah.
You've mentioned about you know, the older generation who, you know, are quite affected with the cataract issues.
Yeah.
But I also read somewhere that problems differ from age to age when you're talking about the state of the eye. Then which age group is more at risk?
So for the elderly population, I would say anyone above the age of 50 years probably just get checked. But as I said, it's not only the elderly population. There are kids born with cataract, congenital cataract. So as much as it's prevalent in that age group, it can also affect the other people. Yes.
So in general, just looking at eye health, who are largely more at risk? You know, when you're talking about myopia, hyperopia, who gets what more frequently? Okay.
So for the refractive errors, at least for that one, we can be able to categorize. So let's start with myopia. Mostly the young population. The onset, the first cases that you'll be getting is among the young population. A good number of them have myopia. Also, we can relate it to the type of lifestyle you're living right now. We use a lot of near work, a lot of gadgets and all that. You're at a higher risk of developing this condition. Something like presbyopia, at least 50% of people above the age of 40 years. Maybe I can start, first of all, explaining these things before I confuse someone. So refractive error is like a big category. Now you group it into different groups. We have myopia, what you call short-sightedness. You're comfortable with things that are close, but things that are far away, you experience problems. Then we have what you call hyperopia. You're comfortable with things that are far away, but when I subject you to near vision activities, you start straining. We have what you call astigmatism. You have blurred near vision and blurred distance vision. Then we have what you call presbyopia, loss of near vision due to age. Anything that you do within arm's length, maybe using thread and needle. Most of our grandparents at home will be like, I'm waiting for my grandkids to come so that they can put as many as they can. That is loss of near vision due to age. Sorting out grain. Using your phone, you notice most of our parents at home, they've zoomed in their writings because they cannot be able to see. So all these conditions can be managed with corrective lenses. Just get your refraction done and all that. So when it comes to myopia, you notice it's among the young population, but it does not mean that if at all you had myopia during your early ages, probably you'll not have it. No, there are people who have more than one refractive error in an eye. So you find somebody has myopia, at the same time they have astigmatism, at the same time they have presbyopia, very much possible. You find somebody who has hyperopia, at the same time they have presbyopia, very much possible. But at the end of the day, at least with technology, there are lenses that can be able to correct all these conditions. Yes.
So technology is good, partly it is also bad on the other hand, because you're looking at a projection that by 2050, nearly 50% of the world's population will be suffering from myopia. So what does this actually mean in real world terms? What exactly is the problem? Is it because of technology now that we are having a lot of kids also so much on screen time, a lot of institutions now also going the digital way, and is that projection really something that we should be worried about?
Yes, first of all, it's something that we should be worried about, because at any point if you have a refractive error, let's say for example myopia, automatically it affects the quality of life that you live, whether we like it or not. Let's say we started off with children. This child has myopia at an early stage. They are at a higher risk of this condition progressing. Okay, this child, probably it's not that they're performing badly in school, but they cannot be able to see. If I'm subjecting you to look at a board and you cannot be able to see, you'll slightly perform worse than what you're supposed to do. It will affect this child's self-esteem. Now we'll now move to talking about mental health. Now we have moved from eye issues to mental health. So it will affect this child's self-esteem. But if at all you can get to this child, give them corrective lenses, they'll see they'll be able to go about their day-to-day activities. And it's not just children alone. As an adult, there are jobs that require you to have a certain visual standard for you to get that job. If at all you go through the eye test, you have not passed the exam, it will affect you as an individual because you've lost your job, you cannot be able to cater for your needs, and directly also affect your dependents. You're a father at home, you're a mother at home, you're the sole breadwinner. If you lose your job today, your self-esteem is low, your mental health is gone. this child is chased from school. So it's a whole crisis, it's a whole public health crisis that needs to be addressed. And also, the projections are high because of the lifestyle that we live. We're doing a lot of near work. So you might, okay, you know, it also depends with the cause of refractive errors. As you said, things like genetic implications, we cannot be able to curb those ones. But things like trying to avoid a lot of near work, spending a lot of time outdoors, at least 2 hours in a day, maybe reducing the amount of time you use your gadgets, at least it will try to reduce these numbers, or rather try to reduce the rate of progression. Yes.
All right. So sometimes somebody should just go outside and touch some grass.
Yes.
It's helpful to the eye.
Please do.
Sometimes we hear that somebody has a pinhole vision, or maybe I've heard of somebody says that they're only seeing it at a 20% you know, rate. What does that mean exactly? If somebody has a pinhole vision, do they see? Can they see you? Can they see me? How does that look like?
You know, for us to say someone cannot be able to see, for us to say, okay, there's no term like legally blind and all that, but for us to say this person cannot be able to see clearly, it means you cannot even be able to perceive light. The different ways in which people can be categorized. So when you look at the chart, you'll notice that there's always like comparisons of how a normal person can be able to see versus somebody who has impaired vision. So they're categorized differently because it will get to a point where, okay, this person cannot be able to see clearly, this person probably has a refractive error. Then you also have categories of people with low vision. Then after low vision, now we start now saying, okay, probably this person is blind. So it entirely depends with how you're categorized. Then also when it comes to the eye, the term pinhole can also be used as a test that we use to determine somebody who has a refractive error or not. Because you see, anybody that you expose them to a reading chart, probably they cannot see because they have other conditions. So you also need to differentiate. So you also do the pinhole test, differentiate, is the low vision as a result of a refractive error or because of the other conditions.
But back to optometry. Do we have enough optometrists in this country?
Unfortunately, no.
Kwa nini daktari hawasomi optometry?
Unfortunately, no, but you're hoping the numbers will rise. Let's say the field is a bit young. Compared to the previous times, the numbers are rising, but compared to the population that we have, it's still not enough. Because we are so many people in the country, even globally, versus the number of eye care practitioners, it's a bit difficult for these people to handle that. And it gets worse, especially in the rural areas. Most of these optometrists or eye care practitioners are concentrated in the urban areas for well-known reasons. So you'll find that the people in the urban areas probably get the services, but when you go to the rural areas, right now you go to Kakuma and all those places, you do not get an eye care practitioner. And probably because of geographical issues, people prefer being in places where they're comfortable. Probably because financial issues, maybe they think they'll get more money in Nairobi and all that. So it's also to encourage people out there, if maybe it's someone who's fresh from school, if you want to explore that route, please feel free. It's a route that has not really been explored by so many people. And it's not just about the clinical practice. It's not just about you being there and dispensing lenses every other day or managing these conditions. There are other things that you can be able to do. You can get into training, you can get into research. So there are so many things that people can do just to make this practice bigger, increase the number of practitioners so that they can be able to do that. And because the numbers are a bit low, that's why you find people seeking help of other practitioners. That's why you'll find you're trying to educate CHPs, go out there, educate people, bring them to ask. That's why you'll find the projects such as basic screening in schools. You're now teaching teachers how to do basic screening, let them be able to do the basic visual acuity for the children. If the child cannot get here, send them to an eye care practitioner. So there's a very big need for eye care practitioners, optometrists to be specific. So hopefully more people get into the field. Yeah.
And as you're talking, I'm just thinking about it, that we have that option of, you know, eye checkup on our insurance. Do people really tap into that? Watu wanaendanga for other things, but for that particular part, you know, the insurance also has a section just for checkup for the eye. We have the one for the teeth as well, but for eyes, do we use it enough?
I do not think people use it. I do not think people explore that. So let's take advantage. If you have that ability, or maybe your employer or yourself, you've insured yourself, make use of those services. Because I believe not so many of them, the cover expires without them going. And you see there are people out there that take insurances. There are companies that take insurances. There are ophthalmologists that take insurances. So just do your due diligence, research on good practitioners. Every year go there, make use of the insurance, get your eyes checked. Yeah.
How are you making it affordable for Kenyans at Dot Class? Because there's something you showed us here that it's only available at Dot Class. Then if access is quite limited, then how is that affordable to each and every Kenyan?
Okay, so for Dot Glasses, our main mission is to provide quality eye care services that are affordable, especially to the underserved communities. You see, earlier on you mentioned somebody has an insurance, but they're not making use of it. That is more of choice. We have people out there that really need these services, but they cannot get it because of various reasons. First of all, costs. That's the elephant in the room. You see, right now, if I go to for normal eye test, I'm told to maybe buy spectacles worth 20,000, for example. Even if you're on a pay slip, you'll have to sit down and be like, do I need to cough this 20,000 to get these spectacles? Now consider somebody who's in the rural areas, or even in Nairobi, but they're earning, it's more of hand to mouth. Maybe they earn 200 shillings in a day. For this person to be able to save until 20K, that's practically impossible. They'll forget about it until the day when they're high myopes, then now it's a problem. But you see, for us, we provide quality spectacles, like what I'm wearing, very durable. As much as you can be able to remove them and all that, they're durable. They do not easily break and all that. So if at all I can be able to get spectacles at around 700 shillings, a full pair of spectacles, 1,000 bob, that I can be able to use for as long as I want. Worst case scenario, maybe something happens, maybe your child forcefully breaks it, for example, here, that is doomed to happen. You can always replace one part. Value for money. So imagine getting spectacles at an affordable rate that will serve you for a very long time. That's one way that we do that. Another way, as I said, educating people, and also another way, making use of other practitioners who can be able to help us do that. So other than that, we also have this gadget. Yes, I said it's scarce, but for Dot Glasses, it's not scarce. If at all you want it, you can always get it. It's affordable. If you compare with the prices that you get for any eye care practitioner, if at all you approach any eye care practitioner, if at all they know the value of this, trust me, they'll always get it because they understand the cost implication and what you're offering them. So we try as much as we can to provide services across the board at an affordable rate so that every common mwananchi can be able to access these services.
So where can we, of course, access Dot Class?
Okay, so as Dot Glasses, we have different partners. So what we do, we have our main offices. If at all you want to pay us a visit, we're at Parks Mayfair, Westlands. Then other than that, maybe you can get us on our social media handles at Dot Glasses. We're on all social media handles. Then if at all you need to book an appointment, what you do is that you'll reach out to us. Then we'll link you to our nearest partner because we partner with practitioners. So you can reach us on 0758 358 934. So that's our customer care number. That is 0758 358 934. Then from there, we'll be able to offer you the necessary services that you need. Whether you're an eye care practitioner, whether you're a practitioner who is in need of these gadgets, we'll be able to supply you. Whether you're someone at home who has always had issues with their eyes, but you do not know where to start from, just feel free to reach out to us. We'll be able to guide you on these services that you can be able to access. Also, we partner with other senior eye care practitioners. So if at all it's something that needs a high-level consultation, we'll always refer you to somewhere that you know you'll get these services from. Yeah.
All right, let's get final feedback as we wrap up this discussion. Lydia from Thika says, my child is always on a tablet. Now I'm worried. How do we protect kids from this? Peter from Machako says, honestly, I ignore the signs, burning eyes, dryness, but now I see it's serious. Thank you so much for interacting with us. And of course, thank you so much, Faiza, for making time. Our guest this morning, as I've said, is Faiza Saida. Faiza is an optometrist at Dot Glasses, Kenya. We are looking at eye health this morning, World Optometry Week. 22nd of March to 28th of March. So we are still in that period. Today is the 26th of March, so it's going up until, is it Saturday? All right, so Saturday it will be the culmination of World Optometry Week. Thank you so much for watching, and thank you so much for keeping us company. Let's continue on our socials, TV47 Kenya on Facebook and on YouTube, on X, at TV47 Digital. Remember to tag me at @_did, and our WhatsApp line is also very active 24/7, 0793 267 279. That brings us to the end. Thank you so much. Good morning. My name is Anne Odida.